This is for Communications 11, and this is my project on informative speech. Imagine going to sleep excited for an event, only to wake up the next morning with a small bump on your face. For many people, acne is not just a skin condition, but something that affects confidence in daily life. Acne is one of the most common skin conditions, especially among teens and young adults. Despite this, many people do not fully understand how it forms or how to properly treat it. And not seeing a dermatologist, people might use ineffective or harmful methods when trying to get rid of it. Today, I will explain how acne forms, describe the most common types of acne, and discuss common treatment and care options so that you can understand how to actually manage it. First, I'll explain how acne forms so you can understand the biological aspect of breakouts. Acne forms when pores become clogged with oil, dead skin cells, and bacteria, leading to inflammation. The first factor in acne forming is the overproduction of oil, also known as sebum. Sebum is naturally produced by sebaceous glands to keep the skin hydrated. However, hormonal changes, especially during puberty, can increase oil production and lead to clogged pores. People usually understand sebum as the little white dots on your nose, and they are called sebaceous filaments. The second factor is the buildup of skin cells. Normally, dead skin cells shed naturally from the surface of the skin. But when someone has acne, these skin cells can stick together with oil and block the follicle instead of shedding properly. According to the National Institute of Arthritis, this mixture prevents oil from reaching the surface of the skin and creates a blockage. The third step is the growth of bacteria inside clogged pores. The blocked environment allows bacteria to multiply, which leads to inflammation. This is the thing that causes redness, swelling, heat, and pain. The final step is the formation of acne itself. When the follicle wall breaks, the bacteria, oil, and skin cells spread into nearby skin. This creates the visible pimples that we see. And by spreading, this is what we call breakouts. It's multiple acnes just on your face or in multiple parts of your face. It can also be on your back or other parts of your body as well. Now that we understand how acne is formed, I will describe the most common types. Acne appears in several lesions varying in severity and appearance. The first type is a non-inflammatory acne, which is whiteheads and blackheads. Whiteheads form when clogged pores remain closed under the skin, creating a small white bump. Blackheads is when clogged pores open and are exposed to air, causing the oil to oxidize and turn dark. This is not because it turns dirty. The second type is inflammatory acne, which includes papules and pustules. Papules are small, red, tender bumps that are caused by inflammation. These do not have any type of pus, but pustules are. These are often with red at the base. The third type includes a more severe form, such as nodules and cysts. Nodules are large, painful lesions that form really, really deep. Cystic acne consists of deep pus-filled lesions that can lead to scarring. Most people, when they get rid of this, go to the dermatologist because they are so deep and are painful. According to the US dermatology partners, acne can overlap and vary from person to person, which is why understanding your specific type is important for choosing the right treatment, especially when you have multiple types on top of each other. Lastly, I will discuss common treatment and cure options so that you can understand how acne can be managed effectively. Acne can be managed through skincare, medical treatments, and lifestyle awareness. The first solution is maintaining a consistent skincare routine. Gentle cleansing, sometimes double cleansing, at least known in the Asian world, where you cleanse with a regular foam cleanser and an oil cleanser, helps remove excess oils and debris while avoiding harsh scrubbing. This also prevents further irritation and damage to the skin. The second approach is using treatments that target the cause of acne. According to the Mayo Clinic, acne medications work by reducing oil production, clearing clogged pores, and treating bacterial infection. These treatments can include topical medication like retinoids and antibiotics, as well as oral medications for severe cases. You are also able to use uh, pregnancy pills to reduce the inflammation as well and prevent more scarring. The third approach involves understanding contributing factors. Hormones, especially during puberty, increase oil production, while family history, which has a history of sensitive skin, medications for anything, and other ages can influence acne development. The final approach is avoiding factors that worsen acne. Stress, pressure from tight clothing, backpacks, environmental irritants, or sometimes your diet can make acne worse. Usually, things like dairy is a common factor. Additionally, picking up or squeezing pimples can increase this and lead to scarring. The scarring can be ice pick depending on how hard you scratch and other. Acne is a common condition but is often misunderstood. By explaining how acne forms, describing the different types, and discussing treatment and care options, it becomes clear that acne is caused by a combination of oil, skin cells, and bacteria. As a reminder, this is not poor hygiene. Understanding this allows people to make a more informed decision based on their skin type and treatment options. So now the next time you experience a breakout, instead of feeling frustrated, you can recognize what's happening and take the right steps to manage it effectively.